Hello, everyone. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello Sports Medicine Report. Today I'm going to cover rehabilitation of an oblique muscle strain. I already have a video out on the oblique muscle strain where I give a lot of details on the mechanism of injury, but I get a great deal of questions about rehabilitation of this injury. This is a serious injury that takes a long time to recover. Obviously, the recovery time depends on the severity of the injury. What I'm going to speak about today is just some general guidelines that you can follow and get into a little bit more specifics on the plan. Now, you always want to remember everyone's condition is a little bit different, and you always want to make sure that you see a medical professional to make sure you get the proper diagnosis and the testing that you need. You also want to work with some type of medical or fitness professional so that you are on the right path for your recovery. Please make sure that you see a medical professional and work with a medical professional or a fitness professional on your recovery for an oblique muscle strain. Watching this video does not take the place of seeing a medical professional or working with a medical or fitness professional for your rehabilitation of an oblique muscle strain. For the general guidelines, there are some very important points that you always want to remember. Please remember, you are rehabilitating an injury. You are not training for a competition. You want to start at your current health and fitness level. Do not try to start at where you were at before the injury occurred. Do not try to start at a level that you used to start at when you were younger or that you used to perform previously during another training adventure. So please remember, always start at your current fitness level and that you are rehabilitating an injury. Another point is you want to make sure that you never perform an exercise. It doesn't matter if it's stretching exercise, a strengthening exercise, a motion exercise that elicits or intensifies symptoms. Again, never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, modify that exercise, make that exercise less intense, or skip that exercise and find a viable substitute. When performing an exercise, always work through a symptom-free range of motion. It doesn't matter how small that range of motion is, you want to always work through a symptom-free range of motion. Again, always work through a symptom-free range of motion. If you are doing a stretch, move into the stretch slowly. Hold a mild, comfortable stretch, then move out of the stretch slowly. Increase the intensity of your rehabilitation exercises in small, gradual, calculated increments. Again, increase the intensity in small, gradual, calculated increments. Make sure that you are not trying to progress too quickly, because many times I have seen people make their injury worse or increase their symptoms by trying to rehabilitate their injury too quickly. So you want to make sure that you are increasing the intensity in very small, very gradual, very calculated increments. Make sure that you get adequate rest between training sessions. If you are still sore from a previous training session, take an extra day off. Do not push it too hard. Give yourself a chance to recover from your previous rehabilitation exercise. Always keep a training and a nutritional journal. Write down everything that you do. Write down how far you do an exercise, the number of repetitions, the resistance, how an exercise feels while you're doing it, immediately afterwards you're doing it, an hour, even the next morning after you've done it. Keep detailed notes. This will help you in your progress. And always modify your training so that you are figuring out exactly what is working for you. Do not be afraid to modify your training because you want to figure out what works for you. You don't want to do what works for someone else or what someone else tells you that worked for them. You could use those as information and try that, but specifically you want to perform exercises that work for you. And the last are the general guidelines. This is about nutrition and supplementation. Utilize nutritional and supplementation strategies that are proven and that work for you. More specific exercises for the oblique muscle strain rehabilitation. First thing that you want to do is start with slow and controlled range of motion exercises through a symptom-free range of motion. I know I said that before about the symptom-free range of motion, but it is so important. You want to move slowly, control your motions going in all directions, and you want to make sure that you work through a symptom-free range of motion. Now these motions can be spinal motions where you're moving forward into flexion, you're moving backwards into extension, you are rotating the spine to the left and to the right, and you are bending to the left and to the right. Even if the range of motion is minuscule, I mean very small, that you have to work through to be in a symptom-free range of motion, start with that. Please do not move into any motion that elicits or intensifies symptoms. You could also perform pelvic motions where you are moving the pelvis, shifting it to the side, called a lateral shift. You can go to the left and to the right. You can also perform where you are doing rotations with the pelvis and figure eights, and also just a basic pelvic tilt motion. This is a very good starting point for your rehabilitation for an oblique muscle strain. The next step would be performing isometric strengthening exercises. These exercises include, but are not limited to, an isometric pelvic tilt, the abdominal drawing in maneuver, a 90-90 bridge, even building to a plank or a side plank. You can also do stomach vacuums. These are core strengthening exercises. The next step would be performing light stretching exercises. Move into the stretch slowly, hold a mild, comfortable stretch, and move out of the stretch slowly. When I speak about stretching, I always tell people, you are not stretching to be a contortionist. You are not stretching to be a circus performer. You are stretching to rehabilitate an injury. So please move into the stretch slowly. Hold a mild, comfortable stretch, and then move out of the stretch slowly. The next step is to slightly intensify the isometric strengthening exercises. I spoke about planks and side planks. You can now start doing side planks where you are bending the pelvis, you're lowering the pelvis, then you're raising the pelvis up, or you are rotating and you're going to be directly strengthening the oblique muscles. You can also do different types of planks where you are lifting the arms and the legs. These are a little bit more advanced type of planks, so obviously you want to build up to them. Then the last couple steps would be to increase the intensity of your stretching. And what I mean by that is just to stretch a little bit farther. This naturally happens as you stretch more. So this will help to decrease the muscle tension in those areas. Again, when you are stretching, the purpose is to decrease the muscle tension. So move into the stretch slowly and hold a mild, comfortable stretch, then move out of the stretch slowly. Then you could start to perform motion strengthening exercises. You can start performing strengthening exercises where you are moving a little bit more. This will help you when you start preparing for return to sport. And once you feel that you can actually return to sport, you want to do some sport-specific training. Take your time and make sure that whatever sport you are training for, you can build up to performing in a competition. So take your time, train in your sport, doing sport-specific training. Thank you, everybody, for viewing today's episode of Dr. Ozello Sports Medicine Report, where I cover the oblique muscle strain rehabilitation. I know that I spoke a lot about general guidelines, and I know I spoke a lot about safety, but it's so important to prevent a recurrence and to make sure that you are rehabilitating these muscles correctly, and that you do not aggravate your condition and spend a longer amount of time performing recovery. So please take your time and work in very small, gradual increments when you are increasing the intensity. You're going to have to be patient. And I know that may be the last thing that you want to hear, but if you are patient and you do this correctly, it will help you to recover completely, and it will help you to prevent a recurrence. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on the book. The book is available in paperback and ebook formats. On my website, you can also find my blog. My blog contains articles on sports medicine, health, fitness, and chiropractic. And also on my website, you could connect with me on other social media formats. Thank you again for viewing today's episode of Dr. Ozello Sports Medicine Report, where I covered rehabilitation of an oblique muscle strain. Please feel free to like this video. If you have questions, suggestions, or feedback, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. Always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.